Hello, welcome to Biofilm News. My name is Pavel Ryzhov. This is where I break down the recent news from the healthcare, pharmaceutical industry, and life science research. Please subscribe and spread the word. Hit the notification bell to stay up to date. Let's get started. Electronic health records, or EHRs, are the topic of conversation of the past several years, ever since their introduction and integration into pre-existing mechanisms of keeping track of patients' medical history. Essentially, EHRs are the software solutions that are meant to alleviate some of the burden from both physicians and patients when it comes to managing the health information, ranging from checkups to prescriptions to more complicated interventions. On paper, or should I say on a computer, the idea of centralized health data management that is both accessible and accurate sounds fantastic, and should improve the standard of care by alleviating mistakes when transferring the information between departments or hospitals. However, on practice this is far from the truth. If you didn't know about this issue, chances are that the incidents are being buried under privacy clauses, non-disclosure agreements, and settlements. This is in fact what's going on. The implementations of EHRs in the United States resulted in a situation where they are plagued by software bugs and poor user interface. Unfortunately, it has severe consequences, and scathing legal cases are mounting up against the hospitals and the EHR vendors because the mistakes result in serious health risks or even deadly outcomes for patients. While the severity of the mistakes that are done as a result of interacting with EHRs cannot be emphasized enough, let's instead focus on the possible solutions to this problem. To do that, let's identify the core functions that EHRs should deliver on. First, it should help physicians to accurately record and monitor their patients' medical history. Secondly, it should robustly manage the information exchange between users, for example between physicians who order a test and the laboratory that needs to execute the request. Thirdly, the software solutions for EHR should be adaptive and flexible to quickly report and fix the bugs and improve user interface. Efforts are being made to report the bugs and errors in the EHRs and raise awareness about current implementation. For example, you can visit the following website to obtain information about how to deal with EHRs as a patient and what steps you can take to take more control of your health data upon interaction with a physician. The today's featured article goes into more detail about specific patient stories and current state of EHR implementation in the United States, so I encourage you to visit it and engage in a conversation by commenting under this video and sharing it. I'll see you next time.